and facing the face cradle. Are you having any discomfort today?
Yes.
Now, what I know about Dee is that she works at a computer most days, and when you're working at a computer, your head is down. With the activities that we do these days, whether it's driving or on our cell phones or on our computers, our heads are down a lot, and that's causing a lot of spinal problems. Even with myself, I find myself guilty on looking down at my phone a lot, so I'm trying to hold it up a little bit more so that I'm not going like that, because we're going to end up looking down at our feet by the time that we're 90. So even Dr. Hall and we're seeing a lot of spinal problems because of these fun little daily activities that we do. So does anybody have any questions? Yes, Kevin.
Where do you get a massage?
I have a massage therapist down in Tempe that I see. My husband and I, we book appointments and we'll go down on a Saturday together, because if I don't go, he won't go. So we make sure that we try to get down there probably every 2 to 3 months.
You don't do your husband's massages?
No, I do not.
Probably needs to stuff.
After the shoemaker's kids, they have holes in their shoes. So I'm the same way. He's not really a big complainer, but I think we enjoy it a lot more when we don't have to worry about that. Yes, Nancy.
Do you do foot reflexology?
I do not. I am not certified in reflexology. However, I do foot massages. It's not something that I studied, unfortunately. Yes, Shane.
What are your thoughts on foam rolling?
I don't know. I don't have any opinion on foam rolling.
For those who don't know, foam rolling it's myofascial release, kind of like what the massage does, and it's kind of like a self-application.
Oh, thank you. Thank you. That's fairly new then. Yes, Kevin.
So how would you classify or identify your area of expertise?
I focus more on the clinical part of injury and rehabilitation. I have actually, since I've moved here to Arizona, I have not been able to grasp the continuing education part yet. I've kind of been out of the loop for about 5 years. I used to be a very active member of the American Massage Therapy Association. I used to do a lot of traveling. I used to be on the road a lot. I used to be doing nurses conventions throughout the country. There was actually 1 year where I spent 5 years or 5 months away from home. And so I had enough of that, and I'm trying to stay local more than anything. But this year I am very on board on getting more continuing education so that I can learn more about these new things that are popping up, just like what Shane had answered. Yes?
Is it better to go to the chiropractor first and then get a massage?
You know, that's a 50-50 split. I usually tell people to kind of be their own best, to use their best judgment. Sometimes seeing the chiropractor first helps them. Other times seeing the massage therapist first is very helpful because it loosens up the muscles, less discomfort for the patient, and easier adjustment for the chiropractor to get those things to move. So that's personal preference. Yes, JT.
Do you have any partnerships with senior living facilities where you go in and do massages?
I do not. I do not.
Are you open to that?
Sure. Yeah, if I'm able to.
Dorothy.
Oh, I'm sorry. I'm looking at you, and I think yes, Dorothy.
Would you go to an organizational meeting like the chamber or something and set
Sure.
up
If somebody was
they
to call
wanted
me,
you
absolutely.
to do that?
Absolutely.
Okay.
Get your turn around again.
Yes, ma'am.
Do you dictate to the patient's chart?
Pardon
Do
me?
you do the dictation to the patient's chart?
Yes.
Do-
Do you do the diagnosis
oh,
or
yeah.
dictation to the patient's
Dictation?
chart?
Oh, absolutely. Absolutely. I do.
Do you diagnose,
I do not diagnose. It's out of my scope of practice.
so you refer to the
Yes.
chiropractor and the
Yes,
You testify?
I can. I've testified once.
Okay.
Along those lines, could you talk a little bit about the advantages of being located in a chiropractic center as
Oh,
opposed to out of
absolutely.
house?
The traffic, the people that come through. I'm starting all over brand new here. And being within a chiropractor's office practice, that's been very helpful for me because I get the front exposure on being there. I'm actually now in a big pond. I'm a little fish in a big pond, so it's a big change. Things have changed a lot in the profession, and I'm finding that I'm working with a lot more older people. I used to work in a geriatric clinic back in Vermont, and I really enjoyed it. And now working in a chiropractor's office close to the Sun City area, that's even more fulfilling. So that's yeah.
What's the benefit of going to you versus Massage Envy?
Massage Envy, I have nothing against them, but they're cookie cutter and they try to sell you a product. And that really bothers me. I once had a very bad experience on a cruise ship once, and I had a great massage, and they sat me up and tried to sell me cellulite tablets. And that's exactly what they try to do in those places. They try to sell you lotions and oils and stuff after you've had a massage. They try to sell you all this stuff, and that takes the beauty out of the treatment.
You're all mushy and easy.
Yeah, and they want to try to sell you something. I'm not going to try to sell you something except good health.
Wow.
And I'm not cookie cutter, so that's a good thing. I'll take the time to focus on your health.
Good job.